Okay, so we're going to begin right now with this press conference at the Valley Health Center, East Valley, 1993 McKee Road, San Jose, California, on June 11th, 2020 at 12 noon. And we are in this press conference to let the representatives, local, regional, and statewide, as well as all the task force that have been developed as a result of this COVID pandemic. We want to send a message, and we want to incorporate our message to those that are responsible for the well-being of our community. We also want to introduce to you the speakers at this press conference. Myself, Citlalmina, will read the press release in English. Adrian Tepewa from the Barrio Defense Committee will read the press release in Spanish. Sharot Lynn from the Peace and Justice Center will read the accessibility of information. Karina Gallardo from Somos Mayfair will read the demand number 1. Adrian Tepewa Vargas will read on behalf of the seniors demand number 2. Citlalmina from the Barrio Defense Committee will read number 4. Mohini Jadho from the California Nurses Association will read demand number 6. Mike Paradela from the Party for Socialist Liberation will read demand number 7 and 8. The title of the immediate press release is Coalition Calls for Special Measures to Address COVID-19 Cases Amongst Minorities in San Jose, Califaxlan. The Barrio Defense Committee, BDC, a representative organization of grassroots people and other allied organizations, are hereby calling upon the Santa Clara County and City of San Jose governmental administrations and elected officials to take immediate response actions to address the disproportionate COVID-19 coronavirus infections in the Mexicano, Chicano, Latino, and Asian, and other economically impacted communities in our barrios. Of issue is the format of the way COVID-19 information is being provided on the COVID County Informational website. It does not break out stats by ethnicity in relation to location of age. There are great concerns for our elders. Accessibility of promotional information is dependent only by internet means, and there do not seem to be clear prompts as to where Spanish and other multiple languages can go for information. We need popular forms of awareness. The Los Angeles Times just recently reported that throughout California, janitors, caregivers, farm workers, fast food workers, and delivery truck workers, plus many more service workers, essential workers, were 80% Mexican, Chicano, Latino workers, as opposed to 40% of the population. The numbers reflect that Mexicano, Chicano, Latino workers are twice at risk to get infected with coronavirus, and it has come to bear. This is a direct conscious or unconscious attack on our people. The most economically hit sectors are simply being hit twice as hard for the risk of infection. It is also a direct result of the exploitation of these workers by a twisted capitalist system of economics that is well endowed to target and control, for the time being, the disenfranchised and working class. Yet, we will not allow for any deceit should come to bear upon us in any disguise. It is now time that governmental agencies show you truly care in true humanistic and not profit motive form for your brethren who elected you, and not respond as patriarchs or with gesture of despotic foolishness and in a natural crisis. This coalition of grassroots organizations makes a demand to our local governmental officials to be fully and really transparent in its response. Take effective, even if risky, response and target resources to government staff to accurately identify and track for coronavirus outbreaks in these communities. The following to our local and state governmental agencies are in the form of unified popular demands and are all of equal importance and priority to us. Number one, more information on the awareness of COVID-19 and the importance of protection to the community in Spanish and other languages, such as flyers, billboards, and posters with continuous reporting on the progression of the COVID-19. We must also have community education led by the community in languages where COVID-19 has penetrated the most. Mobile vans must be provided throughout the affected zones. Demand number two, continuous reporting on the state of elders and what is being done to protect them, as it is the highest percentage of infected and deaths. Demand number three, that public institutions such as the fire department, ambulance, and community organizations provide and distribute face masks to the people, or fund community organizations to buy face masks for distribution. Number four, demand number four, need to have community clinics conduct testings instead of private companies and corporations. Demand number five, need to have more testing sites and a method of signing up to get tested, such as walk-up testings. Demand number six, the Regional Medical Center owned by Hospital Corporation of America, HCA, must not be allowed to close its obstetrics, prenatal, maternity, and neonatal care facilities, contrary to Regional Medical Center's claims that there are not enough births to justify keeping the maternity ward open. Vital statistics show that there is a higher than average birth rate, including in the Mexican, Chicano, Latino community on San Jose East Side. And RMC is the only hospital serving that area. Regional medical centers' suggestion that birthing mothers can instead go to Good Samaritan Hospital makes no sense because it is 15 miles away. No other hospital is close to the east side. Demand number 7. Need to open up hotels for the homeless immediately. Santa Clara County has failed in utilizing funds the governor has distributed for these needs. And demand number 8, rents must be canceled and shelters must be put in place. The COVID-19 has violently impacted our community's lives with loss of jobs, inflicted with loss of our homes, for not being able to pay for mortgages or rents. And now we're facing death with the COVID-19 pandemic, but also with the vile aggression of killer cops. This is how the local, county, and state governments are responding to this crisis that we are facing. Moreover, community social activist organizations such as We Represent should receive direct reports of civic efforts to deal with this inequity, including what short-term and long-term plans may exist to stem this disproportionate tide so we can have a sense of self-determination and monitor efforts ourselves. We are not politicians, but concerned citizens and residents. That must be understood. We stand present to take matters in our own hands should our tax-supported governmental agencies, which should be the response, should not respond. We will work to whatever extent with you to save our own adult working people, living contributors to our society, and especially to protect our beloved elders.
¡Que viva!
Que viva, compañero, en español.
La coalición que se ha formulado pide medidas especiales para abordar casos de COVID-19 entre minorías en San José. El Comité de Defensa del Barrio, una organización representativa de personas de base y otras organizaciones aliadas por la presente, hacen un llamado al Condado de Santa Clara y las administraciones gubernamentales y funcionarios electos de la ciudad de San José para formar medidas de respuesta inmediata para abordar el tema de infecciones desproporcionadas de COVID-19 en comunidades mexicanas, chicanas, latinas y asiáticas y otras comunidades económicamente afectadas en nuestros barrios. El problema, o uno de los problemas principales, es el formato de la forma en que se proporciona la información de COVID-19 en el sitio de web informativo del condado de COVID-19. No desglosa las estadísticas por etnia en relación con la ubicación de la edad. Existen grandes estadísticas por etnia en relación con la ubicación o la edad. El periódico Los Angeles Times informó recientemente que en toda California los conserjes, trabajadores de limpieza, cuidadores de gente como soy yo, trabajadores agrícolas, trabajadores de comida rápida y trabajadores de camiones de reparto, además de muchos más trabajadores de servicio, los trabajadores esenciales fueron 80% de trabajadores latinos en lugar de ser el 40% de la población. Los números reflejan que trabajadores mexicanos latinos corren el doble riesgo de infectarse con el coronavirus. Y esto se ha visto. Esto es un directo ataque consciente o inconsciente a nuestra gente. También es un resultado directo de la explotación de estos trabajadores por un sistema económico capitalista retorcido que está bien dotado en apuntar y controlar por el momento a la clase trabajadora y privada de sus derechos. Sin embargo, no permitimos ningún engaño que pueda afectarnos de ninguna manera. Ahora es el tiempo, el momento de que las agencias gubernamentales demuestren que realmente se preocupen en forma verdaderamente humanista y sin ánimo de lucro por los hermanos que los eligieron y no responden con patriarcas o con gestos de tontería despótica en una crisis natural. Esta coalición de organizaciones de base exige a nuestros funcionarios del gobierno local que sean totalmente, realmente transparentes en su respuesta, que sean efectivos, incluso si son riesgos, y que destinen recursos al personal del gobierno para identificar con precisión, arrastrar los brotes de coronavirus en estas comunidades. Las siguientes peticiones a nuestras agencias gubernamentales, locales y estatales tienen la forma de demandas populares, unificadas, de igual importancia, prioridad para nosotros. 1. Más información sobre el conocimiento de COVID-19 y la importancia de la protección a la comunidad en español y otros idiomas. También debemos de tener una educación comunitaria dirigida por miembros de la comunidad en los idiomas donde COVID-19 ha penetrado más. Camiones movibles deben de proveerse y estar en todas las zonas afectadas. Número 2, demanda número 2. Informe continuo sobre el estado de los adultos mayores y lo que se está haciendo para protegerlos. Demanda 3. Que las instituciones públicas como el Departamento de Bomberos, la ambulancia y las organizaciones comunitarias brinden y distribuyan máscaras faciales a las personas. Es necesario que las clínicas comunitarias realicen pruebas en lugar de empresas y corporaciones privadas. Se necesita tener más sitios de prueba y un método de registro para hacer la prueba, como las pruebas sin cita previa, y proteger la privacidad del individuo. Demanda número 6. El Centro Médico Regional, que está allá, miro, y los dueños de la Corporación Hospital de América, HCA, no se deben permitir que cierre sus centros de atención obstétrica, prenatal, de maternidad y neonatal. Por otro lado, el reclamo del Centro Médico Regional que no hay suficientes nacimientos para justificar mantener la sala de maternidad abierta. Las estadísticas vitales muestran que hay una tasa de vitalidad más alta que la media, incluyendo en la comunidad mexicana, chicana, latina, en el lado del este de San José. Y el Centro Médico Regional es el único hospital sirviendo el área. El Centro Médico Regional sugiere, por otro lado, que las madres que dan luz acudan al Hospital Buen Samatario, lo cual no tiene sentido porque la distancia es de 15 minutos o más de lejos. No hay otro hospital que esté cerca en el lado del este de San José más que este, para las mujeres que van a dar luz. Demanda número 7. Necesidad de abrir hoteles para los indigentes. El condado de Santa Clara ha fallado en utilizar los fondos que el gobernador Newsom ha distribuido para estas necesidades. Ha fallado. No se ha visto aquí. Los número 8, demanda número 8. Los alquileres deben de cancelarse y los refugios deben de establecerse. El COVID-19 ha impactado violentamente las vidas de nuestra comunidad con la pérdida de empleos infligidos por la pérdida de nuestros hogares o no poder pagar nuestras hipotecas o alquileres. Y ahora nos enfrentamos a la muerte con la pandemia COVID-19, pero también con la vil agresión de policías asesinos. Así es como el gobierno local, el gobierno del estado están respondiendo en esta crisis a la que nos enfrentamos. No somos políticos, sino ciudadanos y residentes preocupados. Esto debe ser entendido. Estamos presentes para tomar el asunto en nuestras propias manos. Si nuestras agencias gubernamentales, respaldadas por nuestros impuestos, que deberían ser la respuesta, no responden. Trabajaremos en cualquier medida con las agencias y la comunidad para salvar a nuestros propios trabajadores, adultos mayores y contribuyentes vivos para nuestra sociedad, y especialmente para proteger a nuestros amados ancianos.
My name is Clara. I'm with the San Jose Peace and Justice Center. I've been in the field of public health for most of my career, and this COVID-19 pandemic has hit the county very hard, but it has particularly hit very hard the poor communities on the east side of San Jose. And so it's very important that we, not only the community but the county, take measures to deal with the increased level of infection among the communities of the east side, and in particular the Latinx community. To the information on COVID-19, the preventive measures, the incidents, most of this information is in English. We absolutely need all of this information to be available both in print and online. It needs to be in Spanish. It needs to be in Vietnamese at the very minimum, Spanish and Vietnamese. All of this information has to be easily accessible in these languages. Another issue is the testing. So in order for people to access the testing, most of the testing requires a prior appointment, and that prior appointment can only be made online. And that's a severe limitation because there are many families on the east side who don't have a computer or they don't have internet access. And in ordinary times, sure, they could go to a public library, but all the public libraries are closed during the pandemic. So a lot of people do not have internet access, maybe except on their phones. And oftentimes when you go to use your phone and you try to register for testing, it can't be done on a phone because the browser on the phone is not adequate to do that registration by phone. So what is needed is that registering for testing. Well, first of all, it should be possible. There should be enough sites where people can do walk-in testing. We need walk-in testing. We need people at these sites who speak Spanish and who speak Vietnamese. Secondly, we need to give people the option to call in. Everybody can make a phone call. So if they can call in and make an appointment, that will go a long ways towards providing equal access to the testing.
Hi, my name is Karina Gallardo Wolf, and I'm here representing Somos Mayfair and the Eastside San Jose Peace Partnership. This is a group of residents and organizations working together to build a healthy, peaceful, and empowered community. I'm here to advocate for the demand number one. We want more public testing. We want more information in our language, in Spanish and Asian, for the Asian community too. We want flyers and billboards that represent our community, and we want it for the community leaders to speak about COVID-19. We want clinics that are mobile, because a lot of the private organizations, you need to make an appointment, and then you need to have a medical insurance. So for the public who don't have these requirements, it is hard for them to have access to this testing. And that's why in our community, the COVID-19 is spreading. So we need more information, we need more testing, and we want it to be public and accessible. So please listen to the community. We want to work together. And then I wish for this to come to the east side, and not just the east side, but the whole San Jose. We need more testing. Please listen to this demand. Thank you.
I'm going to be addressing demand number 4, which is the need to have community clinics conduct testing instead of private companies and corporations. First of all, we need more clinics in the areas where we have been impacted, such as in the east side. We need more clinics, and we need more testing sites in this area. The fact of the matter is that 42% of our gente have been impacted by the COVID-19. As of right now, there are more than 3,000 people that have been infected, and 40% of our gente have been impacted. Unfortunately, the county has allowed private corporations with volunteers to do the testing. And that is a great contradiction, because the corporations have another role to play, and that is to provide funds, massive funds, to the lack of resources that we have, not to conduct testings. That is for medical personnel that are professional personnel. That is a contradiction. And so we're calling for the county to be more responsible and to not allow these private corporations or private companies to come in.
Under the Barrio Defense Committee and this coalition that we've established, I want to address a couple of high points about our demands regarding the seniors, our elders. Our elders, as we already know, are the most susceptible population to be critically impacted by this virus. In the Latino community, we have a lot of situations where we have elders that do not have documents, elders that live in homes where perhaps their family might not have documents. And so there is a fear of exposing or getting out to seek help because of the danger of INS or ICE, Immigration Services. In addition, our elders in many communities are reticent to seek out medical help just because of medical traditions, healthcare traditions. So it is important to try. It is important to try to identify where our seniors are so that they can get proper help, have their privacy protected, and be secured so that they don't contract this virus. The percentage of seniors that have been contracted this virus among Latino populations is very high. And we have to take measures to get a hold of that. That is the main point I want to make. El punto principal es tenemos que preocuparnos por nuestra gente anciana y darle los servicios que necesitan con acceso y proteger su privacidad.
My name is Mohini and my last name is Jadhav, and I have been working as a nurse for 34 years. I'm a labor and delivery nurse for 34 years. I have been working in women's and children's for the last 34 years. At Regional Medical Center, what I am demanding is to open the women's and children's department. The reason why I'm saying that is because they have closed the Women's and Children's Department on May the 30th. And we have been having a lot of issues. The women are still coming into the emergency room department over here. Our nurses are practicing. Our nurses in the emergency room is practicing labor and delivery. It takes a good 6 months to become a labor and delivery nurse. Not a competent, but to become one. Regional Medical Center has given a health stream in the computer for the emergency room department nurses to take care of a laboring patient. So they're not following the EMTALA law. They are violating the Emergency Medical Treatment Act. They're not doing MSC on these pregnant women. They are not monitoring a pregnant woman that comes into labor and delivery to even see if this baby is alive or not.
Hello, my name is Mike and I'm with the Party for Socialism and Liberation, and we are here in solidarity with the Latinx community of San Jose as well as the working class of San Jose. We are here to continue the demands of providing more resources for the communities of San Jose, and in particular the need to house homeless people as well as cancel rents and small mortgages across the nation. In California alone, 30% of renters will not be able to make rents as of June, and that number is increasing more and more due to the pandemic, and the economic damage that has ravaged the country. So in order for us to understand, like, canceling rent is a way to protect workers and to protect workers of all kinds, whether they're undocumented or have on visas or anything. Canceling rents means they can stay home and be with their families and prevent the further spreading of COVID-19. We need to also remember that we cannot just ask for testing. We need to quarantine and contain people who have the virus. It is only by sheltering people in vacant hotels or canceling rent, encouraging businesses to stay closed. These are very concrete strategies and techniques we can do to prevent the further exposure of COVID-19 and therefore prevent further deaths in the community. Yes, that is it.